Jett Plasma is a device from the Czech Republic that we have been using for eyelid rejuvenation since 2017. Heating the skin causes the collagen to contract. In other words, the skin shrinks, and this heating also generates collagen after 28 days. So it has a neocollagenesis effect, leaving the skin firmer and more hydrated, with a more youthful appearance. This procedure is done with topical anesthesia, anesthetic cream, and in some cases we infiltrate xylocaine with a vase or without a vase. It's done in the office environment, so there's no need for hospitalization. And the big difference with surgery is that it avoids a scar. You don't cut the skin, so it allows for a quicker recovery. Many patients are afraid of the scar. They dread going to the operating room. There are also those who have already undergone blepharoplasty and have a little bit of skin left over. In the last 2 years, we have also developed a protocol to improve fat pockets, enhanced by the use of plasma. So we use substances that reduce fat, which have a lipolytic action, and the plasma has the function of firming the skin in this area, giving it a more youthful appearance because the pockets go backwards, as well as being destroyed by the lipolytics. The ideal patients for Jett Plasma are those who don't have a lot of skin left over with excess in the upper eyelid. Those who have a little sagging in the lower eyelid are also a good indication, but it can't be indicated for all types of patient. Patients with phototypes above 4, it is not indicated. Patients with low eyebrows are also not recommended. And patients with thick dermis, patients with very thick skin, also find more difficult to shrink their tissues. Well, I've been working with Jett Plasma since around 2017, so initially it was this tip, but in 2020, more or less, I started using plasma pen accessory. Plasma pen is an accessory that we attach to the Jett Plasma machine. It's more ergonomic, the tip is thinner, so it makes more precise and smaller dots, and this has repercussions in terms of speed procedure and also a lower risk of hyperpigmentation, around 4%, and it's a transient hyperpigmentation when it occurs. The patient uses 2 weeks of depigmenting agent. The skin has to be prepared. Retinoic acid, hydroquinone and corticosteroids can be used. We can use Hormoskin, Vitacidifus or Blance oils, which are 3 preparations that are ready-made in the pharmacy. The day before, the patient stops using these products. On the day of the procedure, the patient arrives at the office and we give them an analgesic or anti-inflammatory such as Toragesic or Tylenol half an hour before the procedure. We apply a topical anesthetic to the skin, and after 30 minutes we start the procedure. We use 2 techniques. One is scanning, which involves tracing the epidermis, a more superficial treatment, and the other is dot by dot, which is the point-to-point that through the epidermis reaches the superficial dermis, papillary dermis. This device, the Jett Plasma, compared to others, is the only one that scans. Why? It works with the unique patented direct current, while all the other devices on the market have alternating current, which means it only does dot by dot. The procedure takes around 10 minutes on upper eyelid and 10 minutes too on lower eyelid. In order to have better effect of neocollagen, we can use drug delivery. It contains hyaluronic acid, vitamin C, DMAI in cumulose oil extract, which improves microcirculation, and silicon, which contains various antioxidants and also favors the production of elastin and collagen. And we also use depigmenting agents or substances that prevent hyperpigmentation called WCPR, which contains glutathione, carabutene, and various vitamins and antioxidants that prevent post-inflammatory hyperpigmentation. After the procedure, it's important to stay as dry as possible. So for the first 3 days, you can wash your face, but leave the area free of moisturizer and protector. It's only after the 4th day that we start moisturizing and wearing sunglasses. Around the 5th and 6th day, the crosses begin to peel off. Within a week, complete recovery takes place. Then we start using sunscreen. Complete recovery takes around 7 to 10 days, but the maximum effect of neocollagenesis is around 3 months. If we need to reapply, we should wait around 3 months. The other difference between Jett Plasma and other plasma devices is the silver tip. What can we do? It permeates active ingredients. After a month, when the skin has healed, you can use this silver tip in the periocular region. For the face, we can use it on the nasogenian juice, on the glabella perioral, with this tip to attenuate the juices. For the neck and face, we have apartment tips, which are larger tips that cover a larger area, and you can lift the neck and face, as well as permeating the active ingredients. There are other indications, such as the treatment of benign tumors, xanthelasma. We can improve ectropion eyelids. In addition to the eyelid, we can improve static leaks. And today in particular, we are also treating dry eye. Dry eye. I'd like to invite everyone to take a look at the indications for using Jett Plasma. That's it, folks. Thank you very much.